Welcome back to KTN News Center. And right now, discussion on that sad story. I call it sad story because air is that a child, a human being, of shillings, about 3 billion shillings, to take care of these vulnerable and homeless children. But what they get at the end of it begs the question: has the decision by the Director of Public Prosecution to order for investigations and those found Munyuwiny, director at the Africa Institute for Children, family focus. Gentlemen, thank you. Let's just start the discussion by, your sentiments when it comes to what you've seen. Very sad pictures, children that the government is supposed to be taking care of. The government has released funds, they're sharing beds. Some of them are sleeping down. And it's not like a bed that's maybe 2 people are sleeping on a bed, but more than 2. Look at the sort of medical treatment they're being given. A whole bag, of medicine that a child is supposed to finish by the end of the week. The massage they're being given. And it begs the question, what is happening in the society right now? I'll start with you, Samuel.
Brenda, thank you for hosting us. And this is indeed very sad. And very sad also that it's coming from the media. While we appreciate that the ODPP has, begun the process of the investigation, and we expect other agencies to do the same, aren't there systems that will have been able to point to this kind of matters? Well, we want to give her the benefit of doubt that hopefully, let's see what the investigations bring. But with this kind of expose and the pictures we are seeing, for sure, there are agencies that should have been able to identify this kind of mismanagement and corruption, really, because what we're talking about here is misuse of public funds. We're talking about weakness in regulatory environment and oversight. We're talking about ethics, really. If you're talking about trying out, experimenting new treatments on children, any researcher in this country will tell you, we're always very afraid to do any research that touches on children. Not that rob, but you can't rob from a child with disability who's coming for a rescue. There's a lot of smoke to show that there's really fire. Then heads should be rolling.
All right.
By now, we should have seen some very, very clear actions.
All right, Peter.
The reason I'm in this work specifically for a start is because I grew up in institutional care, in an orphanage setting, and hence the compelling urge for me to be part of a team that advocates for family-based care for children. Looking at this expose, to be frank, it's a disgrace. It is traumatizing. It is horrendous and it is horrific to imagine that someone who's sworn an oath of protecting children would actually turn out to be a tormentor of children. And that is really unfortunate. And it definitely brings to the fore a lot of child protection questions that we need to look at very critically as a country. Yeah, because we have failed our children. Yeah, and child protection is everyone's business, Brenda. And it starts from the highest office in the land all the way down. And looking at what has been happening in this entity for so many years is a big travesty.
All right.
Yes.
All right. I mean, even for me, it was so hard when watching it. You sort of like have balancing tears. You wonder what the sort of life these kids live in. But let's just dwell on that story still. And one of the exposés that has been pointed out by my colleague, it is good that we have whistleblowers who are out to say the truth, and they've spoken to us through my colleague Hussein Mohammed. And it begs the question that in that story, you can see where children are being taken for treatment. It's not even a registered health facility, yet you're paying millions of shillings to this facility. Then it looks like there is corruption in it, that people were out to swindle public, to actually just take in public funds because the money is outside that's been given out by the government.
Right, Brenda, and this is why I mentioned what this brings out, which as a country we must ask ourselves, when you have an agency that receives money from the public, what regulatory and mechanisms do you have? And let's go straight into the question of treatment. If a child with disability, and a number of those children who are being shown here are children with disability, we have the National Council for Persons with Disability, with clear procedures on what happens if the child needs special attention and perhaps the families are not able to support that. The National Council for Persons with Disability has a process where you can do a needs assessment, be able then to place this child under special care in terms of being able to access or waiver on NHIF, and then they can go to approved government facilities with very well-trained people who can be able to manage this. So for someone to say they have spent 27 million shillings to try and give a treatment on that is not even approved, it's in itself really a pointer to corruption, because why didn't you follow the provided mechanisms for taking care of these children?
Right.
But like I said earlier on, the question of regulation again, the law puts it very clearly in the Children's Act, under Part 4, looking at the administration and the role of the Director for Children's Services, that they have a role to be able to look at the quality of care that is happening wherever the children have been placed in an appropriate manner. Okay. And here I mean there's a court order and all that process that allows you to have the child.
All right.
And again, placing a child within an institution should really be the last resort. So we should ask ourselves, are there families and parents of these children? Can't they be able to be provided access to other social protection mechanism that allows them to take care of the children?
All right. And Peter, it begs the question, is there a weakness in the overall coordination of child protection sector?
As to whether there's a weakness in the coordination, I must say we have very good laws. We have very good policies. But what we have is a situation where child protection has been politicized in this country. And part of that politicization comes in because of corruption. You find that the Child Welfare Society of Kenya has, from around 2004, consistently been peddling propaganda that is targeted at discrediting and scandalizing the Department of Children's Services, propaganda that is targeted at scandalizing adoption agencies and other players. Why? So that it could actually be hailed for its work as a champion for children's rights. And as a result, money and power gets channeled in their direction. And that is exactly what Madam Irene Mureithi has been very good at for so many years. She's perfected that art.
Okay, but when,
hence affecting coordination.
But when you level those levels again, when you claim, the allegations that you're leveling against her, can you substantiate what you're saying?
Yes. The organization I ran in 2014 put in a judicial review application in the High Court of Kenya because this particular entity had been exempted from the oversight of the adoption committee by the cabinet secretary at the time, Kazungu Kambi. And so we had an issue with that exemption because there's no way an organization that is taking care of thousands of Kenyan children would be put out of the oversight radar. And that was a big concern for us. And so we rallied and marshaled other organizations, and we took in a judicial review 164 of 2014 to court. And Justice Korir, in his ruling, stated that that exemption was in bad faith, was an abuse of office, and it was not in the interest of children by the cabinet secretary. But Child Welfare Society of Kenya, because it has received huge monetary allocations, it challenged that particular order, and the matter went to the Court of Appeal. But the three-judge bench dismissed it on grounds that the High Court judge was right. But to date, this entity continues to operate without any oversight systems or mechanisms.
Okay, so Sami, if not the Child Welfare Society of Kenya is a government agency, then what is the gap in the legislative mechanisms to control such rogue agencies in the country?
Right. I mean, we've got to begin even from the history of Child Welfare Society of Kenya, beginning way back in 1950s. And really, what it is has been a society. And the law that we're currently using to protect children is the Children's Act of 2001. So really to have a law on Child Welfare Society Act of 2014 that makes it a state agency really tells you there's some mischief. How comes we've not picked this? But more importantly, like Peter has put it, that there's been objections around that, and even at parliamentary level, really being asked, we need to go back and check this. Last year there was an attempt, not really an attempt, there was a miscellaneous amendment that was done, again to fortify this assumption that this is a state agency. And really, there are two agencies that are supposed to play a critical role in management of children's services in this country. The National Council for Children's Services and the Department for Children's Services. So those two should be the ones who are able to. Does it mean there's no space for child welfare and other agencies? No, there is, but there must be someone who then does oversight. So why up to now we haven't seen the Director for Children's Service and his office walking into this institution and being able to identify the children and really get
In fact, I was about to ask that, Sammy, because, I mean, if you looked at that story, the sort of, you know, the environment the children are living in, their sleeping environment, it's really questionable, which begs the question, as much as the government says we are funding this organization to take care of our children, does it really take the next step to actually physically go there and see how the public funds are being used?
It's supposed to. The government, Department of Children's Services, is supposed to play that role, but over the years there has been the politicization that has caused a lot of tensions, and Child Welfare Society of Kenya has quite some security systems around its institutions, and allowing a government official to go in there is not an easy thing. So the CWSK has intentionally ensured that it has kept everyone away from their centers. And it's been very hard, and that is why it took whistleblowers from inside to actually bring to the fore these issues. And not forgetting also that when you're talking about institutional integrity, when this organization was made a state corporation in 2014 using as a president's order, the Parliamentary Committee on Delegated Legislation, I have the order of business with me here, recommended annulment of that order in its entirety because it was in conflict with so many other laws, including the Children Act, and as well as the Public Finance Management Act and the likes. But as to whether the issue was conclusively dealt with in Parliament is another question. There has been deliberate attempts at stopping any organizations or entities wanting to question this particular status. Yes.
All right. And even as you talk about that, you know, it's been, you know, the difference here is, and the response that we've received, and you've watched it in that story, is that the people were out to malign, you know, to spoil, to taint the image of the Child Welfare Society of Kenya badly, and it's turning out to be a political thing. Are there people who are out to actually do that, Sammy?
Well, I think it's in public, you know, that there's been an attempt to stop this kind of expose being done. And really, I've worked with child welfare and Irene, and I think if it's really shares the fact that there's nothing wrong they're doing, she'll have allowed this kind of exposition, and herself should have, even by now, said, I step down. If there's any need, you can investigate and be able to find out whether there is that. But again, looking into their cupboard and the skeletons that they carry around scandals, really, so to say. Like he's mentioned, the question of trying to be out of the oversight structure on adoption. Why would you want to do that if you're really doing things in the best interest of the child?
Now, with 1.3 billion shillings, why are we having street children? Because the government has been allocating money this financial year, 1.3 billion shillings.
In fact, there's more than that, because we also have the Street Families Fund. And the allocation to the children's sector is considerably adequate to tackle a lot of these issues in the streets. But then we are looking at a situation whereby there are very loose oversight mechanisms. We are not certain that actually the funding that goes to these institutions is sort of looked clearly and ensuring that actually it reaches these very children. So corruption has come into play. We have impunity at the same time. And until these issues are checked right, then this problem will continue to persist in our society. Yeah, the street children menace or issue will continue. But we also have a lot of civil society organizations and NGOs that are doing quite commendable work trying to rid the streets of these children.
All right.
Maybe Brenda can add to that, you're right that there must be something around the legislation, and it's not like we are not aware about this. So over the last 12 years, there's been an attempt to really improve the legislation. The last 2 years, we've now had really close to getting to it. We have a children bill that was passed and worked through a national steering committee. And unfortunate that, you know, people connected, and really Irene Munyuwiny and the team have had to play down and really bring to a stop. I think it's sort of a delay tactic, maybe so that this kind of things can continue happening. But I think we will need at this point to be able to have a law that strengthens the oversight. So one of the things that is being done is to make sure the National Council for Children's Services is truly an oversight. It's been almost a department within the Directorate of Children's Services. So if we improve that kind of oversight, then this kind of opportunity will be there. So I think one of the things that should be fast-tracked is having a new children's bill.
Let's talk about the physical infrastructure, and the reason as to have that that discussion, it's because, I mean, why is the government investing in physical structure and for children institutions when it has a policy on deinstitutionalization?
Very good question. The shift in the caring of children who are in need of care and protection is not just a Kenya situation, but it's globally. Globally, we have a shift that is targeted at ensuring children are brought up in families and communities. And that is one big question that all civil society actors and even the department itself asks. Why are we investing in this infrastructure? They are calling them foster care centers. And I think the funding has been allocated in around 14 locations in this country. And one of them is the sort of the big one is in Joska right now. And this is a facility that has sort of consumed a lot of taxpayer money. Not even one child has gone in yet because it is not fully complete. But of course, it beats logic and it goes against this momentum of care reform and championing that children be raised in families. So back again to your question, it is about corruption, it's about the lack of oversight, and the fact that the allocations of this funding are sort of hinged on misleading information, as well as just bad intents and malicious intents, really. And I speak that with a lot of certainty, knowing that there's a lot of information and documents to corroborate that in this very city and country. Yeah.
And Sami, let me just, I want to ask you a question which it might look a bit difficult. You might not be in a position to tell us, but I just want to pick your mind on it. I mean, this Child Welfare Society of Kenya has been in operation for several years. Why do you think it took 2 whistleblowers to actually come out and talk about this? Yet they've been in that society for some time.
I think, like we've heard it from the clip, that everyone, even the staff, seem to be very afraid. Unfortunately, even within the agencies that are supposed to play oversight, you get a sense of fear. I hear, and indeed there are reports that show political manipulation. Irene herself has been quoted, she's been recorded as saying, I know people, I'm connected. And so I think what we really want to have is when government agencies and institutions play their role, can we remove the politics out of this so that then they can be held accountable? We've got to get a country where people don't believe they're going to be messiahs out of individuals, but institutions are what make us who we are as a nation. So I want to think it's really because of this so-called connections, which we know, and it's written in the documentation by government, that the patron, at some point Mama Ngina Kenyatta was a patron, the president himself has been a patron, but does he have the kind of information that he needs to be able to understand what exactly is happening within the institutions that they have a role? So I think it just requires that the regulatory, the oversight works out on its job without any fear.
And I've looked at that clip, when it was on air, the story, and my heart was really bleeding for these young children. I mean, it's a baby and a 2-year-old, 3-year-old, they have faith and trust in the people who are supposed to take care of them. But the sort of medical treatment they're being given, it begs the question. And which, does it mean that the Auditor General who audits use of public funds has never decided or has decided, to actually audit the funds that are being given to this institution?
The audit questions arise, and the first audit by that office was done in 2016, and it is in the public domain, and a recent one that was recently released up to the month ending, the date 30th of June 2018. And there has been Auditor General reports, which have sort of pointed that there is nothing amiss regarding the allocations and the use of funding. But then we know very well in this country a lot of things are happening, and so you cannot know what extents or lengths people would go to protect their reputation and image. But it's also very important to think about the child protection fundamentals in this situation, as well as the staff that are working inside there. They have been intimidated over a long time. Children can't voice. Child participation is really at a nil. And so it is important that the requisite organs of state, starting with the Office of the Department of Public Prosecutions and the DCI, safeguard the staff and the children from any further victimization or harm. Yes.
And Sami, as we bring this conversation to an end because of time, what is the way forward? Despite the fact that DPP has spoken about it, Kenyans are waiting to see whether the government is going to take, any action. But even as we wait, are you people looking for, are you people looking at the corridors of justice, walking into the corridors of justice to seek, to seek justice for these vulnerable children?
Right. In any process that we work with children, we say the principle is consider the best interest of the child. In this situation, of course, we need to be able to find an alternative way of, first of all, the management system. I think it will be within a good governance system that, Irene and her team say, okay, we'll give an opportunity to our caretaker team, come and we put our books public and we look at that. But I think there are many other opportunities also to prevent this kind of things so that we are not just reacting. Besides the groups, the Kenya National Commission for Human Rights, we really will have expected them by now that they've already instigated mechanisms to also establish this so that besides what the DPP has, we have clear data. But even at the county level, where these homes are established, we have Area Advisory Council for Children's Services, chaired by the county commissioners and the county children coordinator for children's services. What have they done? Are they doing periodic reports and being able to tell us this is what is happening within the houses?
You've talked about it. I think I can ask my director, Jay, for just a minute as we wind up this conversation. You've talked about it, and one of the whistleblower actually told my colleague, if you had him correctly, he said, I tried reaching out even to politicians, to the county government. I tried reaching out to bloggers, to actually, some bloggers to actually talk about this thing, and I wasn't seeing any light at the end of the tunnel. The only solution I had was to reach out to the media.
The protection of Child Welfare Society of Kenya, unfortunately, it even starts from the CS's office. You hear they got an exemption at the beginning, and even to date, Okuri Atani has to apologize to Kenyan children. He has to apologize because this entity is right under his oversight. How could this happen? And so the protection has been from very high offices, and that is something to query. And that is why I'm very happy today that the US Embassy, for instance, has brought in the FBI in this country to help deal with corruption. This is one recommendation I'm happy to put across. Please, connect the FBI to the team from the Department of Police that is investigating, even as we protect the children. All right.
Okay, gentlemen, thank you so much for talking to us this morning. I've been speaking of course, to Peter,
yes,
and Peter Kamau and Sami Munyuwiny. That name, I got it correctly this time round. Sami Munyuwiny, who is the Executive Director, African Institute of Children Study, and Peter Kamau, who is the Director at Child in Family Focus, talking to us about that investigative story that was done by my colleague Hussein Mohammed. Let's wait and see what will play out at the end of the day. So far, the Director of Public Prosecution has actually responded to a story that was aired by, directing for investigations to be done. So here at KTN News, our work is to actually relay to the public what information we get and just to wait and see what the government will do. Let me take another short break here on KTN News Center, 10 a.m. We shall be right back for the second hour as we wind up KTN News, but of course, as we continue bringing you up to date with what is making the headlines.
This is KTN.